Let's talk health insurance. While I often help people understand life insurance a little better and helping them understand that it is more than just a death benefit when used correctly, I do see a lot of confusion on health insurance. And I want to clarify a couple of things so that you understand what kind of plans you're selecting and what options are available to you. In health insurance, we have four major options, and they can be split into two groups: our qualified plans and our unqualified plans. The separation is three key points. A qualified plan is going to have essential care, meaning your regular visits with a doctor to maintain your health are all covered. You're going to have an out-of-pocket maximum, meaning in any given year, there is the most you're going to pay for covered health care, and pre-existing conditions must be covered, meaning any kind of health you're in before you start the plan, your treatment is covered. For our qualified plans, we have two options. And the most important, the gold standard, is your employer-sponsored plan. The great part about employer-sponsored plan is your employer is going to cover part of the premium that is paid to the insurance company. And they can cover quite a bit of this premium. There is generally a legal minimum that they have to cover from 50 to 80% depending on your state. And they can cover all of your monthly premiums. I have seen some employers who will cover the entire cost of insurance, even for families of their employees, because they care about their employees. So it's a great way to see if your employer truly does care. And these premiums can be very low, not just from them covering part of it, but from the buying power, that negotiating power your employer has, especially if you work for a major employer like Costco. They have such buying power with the insurance carriers. They can negotiate great rates for great insurance for their employees. Often why we see people fight for Costco jobs and never want to leave. It's because those benefits are so great. Another great thing about employer plans is because there's no pre-existing conditions and oftentimes no waiting periods, regardless of your health, when you get onto these plans, you can immediately receive treatment and care for any kind of needs you have, whether it be dentures or root canals on your teeth, or you've got heart problems or need cancer treatment because you were just diagnosed. These are going to be covered and you can receive care immediately upon electing for these policies, generally determined by when your employer says you can elect for benefits. The two major drawbacks that these have is the employer-sponsored part of it. And while I don't see these as deal breakers, it is good to know that your employer is picking a plan, meaning you don't get the option to shop for an insurance plan. It is generally just a, here's your option, or here are the two options we're going to give you, take it or leave it. And then when you do leave the employer, you do lose that coverage. And this isn't such a big deal these days because of the Affordable Care Act, which we'll get to next. But if you wanted to elect for COBRA or were dependent on that coverage, it can be a little harder to lose that coverage if you lost the job. Our second option is that Affordable Care Act I mentioned a second ago. The ACA or Marketplace or Obamacare are the same thing. And this is the thing I see the most people get confused about with the Affordable Care Act. And the primary purpose of the Affordable Care Act was to make sure people had an option outside of their employers to get good coverage. And so the great benefit of this is you have lots of options when shopping for insurance. Your state has several different carriers that are offering plans where you live, and you do get a time once a year to look at all those options to pick a good plan. And working with a good advisor can help you reduce the amount of time it takes to look at those plans because it can be very confusing. There are also subsidies that can help reduce the cost of your insurance through the Affordable Care Act. And this is going to be the trickiest part about navigating the marketplace, is understanding when you qualify for subsidies and what you don't, what has to be reported as income and what doesn't. So working with a good advisor that can help you navigate that can be a great benefit, and they don't make you pay anything extra for that care. Generally, no. An advisor is not going to make you pay anything extra. They might help you understand the plans a little better so you're getting a more accurate price, but they are not inherently going to make a plan more expensive. And the biggest struggle with those subsidies is because they're income-based, they can be really great for low-income situations. But if you're a higher earner, you oftentimes don't qualify for these subsidies. And so they are very expensive plans, which might lead you to one of our other options. Another major drawback this has is the open enrollment period. To help insurance carriers avoid situations where people are just abusing the system, hopping on to get treatment and then hopping off, there is one time a year that all individuals have to enroll for ACA plans, and that is the open enrollment period, generally in November and December, to get a plan for the upcoming year. So making sure you have the time and you set it aside to either work with your advisor or do it yourself is super crucial you get it done. Otherwise, you might lose coverage or be put on a plan automatically that might not be good for you in the coming year. Now, the open enrollment period is the biggest shortcoming of the Affordable Care Act, and it leads to our next option, short-term care. Short-term care plans are offered by major insurance companies to give you the option to have some kind of coverage while you're between jobs or waiting for an open enrollment period to be available to you to get onto a qualified plan. The great part about these is they are very cheap and they can start up almost immediately. As soon as you pass a health questionnaire or a background check, you can start this plan up in a couple of days. And this can be really great for risk management where these plans shine. The idea is you've lost a qualified plan and you just need to make sure you're not going to have any major surprises by a medical bill. If something like a car accident or a broken limb were to come up and you need to go to the emergency room, you have something to cover that major risk. The biggest downside to these short-term plans is they don't qualify, meaning they're not going to have routine care generally. They're not going to cover mental illness, pregnancies, pre-existing conditions. All of this can either disqualify you or they'll just say, hey, this is not covered. Think of it like a plan where you're only going to get covered if you had a bike accident. It is not going to cover your pregnancy or heart condition that you might have already. So this is a great option when you're transitioning between jobs or waiting for an open enrollment period. Just make sure you have the understanding this is more risk management, not true insurance. Our last option is Christian ministries or health shares. These are going to be our more controversial opinion out there. Some agents really do like them, some don't. I'm kind of in the middle myself. And one of the major reasons they are controversial is the faith-based origin. A lot of these are Christian communities getting together to help share insurance costs. And this often means you have to agree to Christian-based ideals or have you agree to a Christian-based oath or some kind of promise in some way. And the Christian ministries I see often don't investigate these, saying like, are you going to church or anything like that? But to elect for these plans, they do have you sign a document saying, I will follow specific Christian rules. And this isn't a deal breaker for most Christians. As a Christian myself, I don't see anything wrong with following these ideas. But I just don't like the idea that in order to get onto this plan, I have to first agree that I'm going to follow your religious beliefs, especially as someone who believes religion is a personal matter. We should not be forcing on others to get health care. On top of having to agree to the Christian-based part of these organizations, they do often have health questionnaires or background checks that they run, and they will often not cover pre-existing conditions. Or if they will cover them, there are large waiting periods before you can get coverage for those conditions, which can be a big deal breaker for people with chronic health problems. I've seen some even deny for pre-existing pregnancies. And the biggest concern I have as an advisor, and the reason I don't offer any of these health shares, is because they are not legally insurance. And they are really clear to make sure they're not, while towing the line, kind of pretending they are. And what I mean by this is there's no legal agreement that both you and the health share agree to, saying that they will cover specific treatment. And they are not going to be using the same insurance words that you might have heard of, like down payment and premium and copays, when talking about what they offer. They'll use other terms and say, this is kind of like our version of a copay. And this is really uncomfortable for me because a lot of these are designed around a reimbursement model, meaning you can't have your hospital or clinic bill them. You self-pay for your treatment and then ask the health share to reimburse you. And reimbursements do exist and they can be really great because it's a reimbursement model, not legally obligated to pay you back. You're kind of at the hope and whims of them paying you back. And a lot of times they do. Like, don't get me wrong, a lot of these health shares do reimburse their members. But if they don't, and you thought a treatment was covered and they're saying it's not, or they're not going to reimburse you for any number of reasons, you have no way of forcing them to reimburse you. I hope this helped you a little bit and you can pick a good plan for yourself moving forward. It is always important that you know what is available to you. I often say have an open and honest conversation, and that is about making sure you know what is available to you and you know what you're getting when you sign up for these plans.